Thank you. My name is Maria Usman. I'm working as a research assistant at Pakistan Institute of Living and Learning. I will be presenting socio-cultural domain for older adult mental health in Pakistan. It's an ongoing systematic review on sustainable developmental goal. Next slide, please. Okay, so as we already discussed, there are 13 SDGs that has proven their impact on mental health of an individual. I will be talking about socio-cultural factor that include SDG number 4, that is and it is linked to SDG number 3, that is good health and well-being in individual. When we talk about socio-cultural factor, there are many elements that come under this domain. As it is mentioned in slide, the elements are like education, social cohesion, social capital, cultural, social class, and so forth. We will be talking about that. Next slide, please. When we looked at the questions, are two questions that we are looking for. One is, what are the social cultural factors associated with mental health disorder, distress condition in Pakistani older adult? And we are also looking that are basically focused on socio-cultural factor for the benefits to reduce mental health disorder, distress condition in older adults in Pakistani population. Next slide, please. We searched 3 databases out of our 6 databases, and these are our preliminary findings. According to that, we screened 107 studies, and we included 9 studies on the basis of abstract. We excluded 6 studies because one was not related to, two were not related to socio-cultural factor, one was qualitative study, and 3 did not have a clearance on the title and abstract of the study. So we did not included them. According to the preliminary findings, 7 studies showed that social isolation and loneliness are related to increased depression in older adults. And it was also found out that family system act as a moderating role for executive dysfunctions in older adult. One study showed that collectivist culture act as a protective factor within Pakistani population. One study showed that cognitive social capital intervention, that is basically interpersonal trust and reciprocity, act as a decreasing depression and physical disability in older adults. Next slide, please. Thank you. This is from my side.
Thank you so much, very much, Maria. Professor Asad Nizami, I'll request you again to please lead the discussion. Thank you.
Okay, thank you for the presentation. I think a very important pertinent point, because when you talk about the social and the cultural determinants, I think both cultures, either you talk about the West and East, have their own parameters and their own merits, how they handle it. But since you're talking about from a Pakistani perspective, it's a blessing that you have your uh, family members who are providing all kinds of care. And I'm sure I would invite Brigadier Manabar and Major Basit to talk a little bit more on it, since they're into the caregiving aspect. And but what is very important again at this time is that I don't know whether, when we are looking into this research synthesis, are we looking at what was happening before 22nd of March, before COVID, and now what is happening now? Because my question always remains about here and now. I do understand that most of the research synthesis are being done on studies published earlier, but I would just very humbly suggest that if you were to move forward, we now need to look at it from a very different dimension. We need to look at what is happening now and what's going to happen next. Because if you want to devise a policy strategy, if you want to devise some services, they will have to drastically change a U-turn. Because with the COVID still persisting and its impact there, I think we need to go into strategies which are more feasible, which are more culturally appropriate, which are more acceptable. And one of the most important thing again comes is, what can you do for the normal population, the community? How can you engage them at this time? Because they still have this fear of COVID. They still have their elderly, though the culture, the environment is conducive, but not letting them possibly have a normal daily activity routine. So I would invite Brigadier Rana, Munawar Rana, and Major Basit. You want to say a few things about how do you see when you're working with the caregivers, that how does this culture and social determinants are helpful?
Yeah, I think Yamiya first. Okay, Dr. Thank you very much for affording us this chance. I would mention something slightly different. That is related to the curriculum of the youth. If we are talking about future, we must educate our youth who are going to handle the problems of mental health in future. At present, even MBBS students are not exposed to the detail of mental health, particularly Alzheimer's. The primary care services providers, they are not really equipped with the essential knowledge unless the patient is referred to the specialist. Till then, a lot of time is wasted. Two, the curriculum of behavioral sciences and the psychology also doesn't cover adequately the important aspects of mental health. And the third is, I personally believe that even at secondary level in Pakistan studies, maybe you can add some information, some essential information for the youngsters to know the impact of mental health on the society and the families and how to handle that. This is what I would like to suggest as far as the future policy is concerned. Thank you very much. Sir.
And from Brigadier Munawar Rana, you want to add on to something?
This is pretty good what Mia Sahib said, but it also brings us down to a very larger aspect of the whole issue, and that is the emotional education of our people right from the beginning. We are faced with emotional problems, and we are faced with dealing with emotional problems with other people early on in life, and sometimes we learn these much too late. Let's say, for example, in my age, we've started learning a few years back how to deal with people who are emotionally disturbed, including people who are in old age, and all those people who are also in Alzheimer's, because all these events do overlap one another. Although I do understand medically they're different, but they do overlap. So a lot of our young people at home or anywhere else who go to deal with these issues, they are themselves completely unequipped themselves to face them or even to understand them. So therefore, in our lives, starting very early on, we do have to teach our people how to become emotionally mature in dealing with issues. And the earlier you start, the better, because I do understand youth have got to be impetuous and they've got to be on a action-reaction stuff. We understand that. But a lot of people have got to temper that behavior with a more emotionally mature behavior so they can deal with all these issues before they spoil the case. So it goes down to that, really. So that's our point here.
Thank you. I think they're very valid, because I do understand that the medical students, not even the medical students, even when people are graduating, though it's part of the curriculum with their postgraduate examination, sections on old age psychiatry and elderly, but somehow it remains ignored. So I hope with this national action plan going on, and the Prime Minister is very enthusiastic about it, we'll be incorporating your suggestions. I think last few comments by Arshad Saab and Sadia, I think they want to share a few bit. So if they're there still, Arshad Saab and Sadia, you want to say a few things?
Thank you, Nizami Saab. I just wish to bring a new perspective in the mental health and older age related discussion. It's a very enlightening discussion for me. Being from Ministry of Health and leading not only Pakistan, but world's second largest social health protection program, catering around 130 million Pakistani population. When I see from the morbidity rate perspective, or for my curative healthcare, I'm already very concerned that my cost sustainability or the economic implications for the older population is likely to increase. It should not be unsustainable for the system or for the national economy. But the new dimension I learned from you guys today is very alarming. And I was just thinking in the background how we can add this mental health aspect, especially related to the older age population who are older now. And very well said, my other colleague, the future olders, the youth population, how we can prevent their mental health disorders in days to come. And currently our program is expanding and is likely to expand like NHS of UK in next 3 to 5 years, catering every single Pakistani, at least for the indoor healthcare services. In the health insurance perspective, this mental health is excluded. I was just wondering how we can include this mental health segment to my package or develop another vertical package. I would like to discuss with my boss, Minister of Health. And also a very helpful suggestion I got from Mr. Zaidi, that our LHWs or lady health visitors would also play a part, especially with the older age population counseling on the mental health issues. And maybe, as said by other colleague about the youth, maybe we can engage our teachers, maybe we can engage our ulama karams. This thing has to be tackled at very strategic level. And ASAP, as you very well said, that NCD and Mental Disorder National Action Plan is currently under process at our ministry. And definitely, I would like to bring all those suggestions, which I just heard on this forum, to the top policy makers. And we would like to include, and also we would love to get the holistic document from your side for our review and inclusion in the document. But I'm just putting a question to all the distinguished guests here, how we can include this mental health portion with regard to our social health protection plan, just for my understanding and for our consideration. Thank you.
Okay. Thank you, Asad. I'm sure your question is pertinent, but I think we're catching with time. But one of the easiest answer is that the EMRO region, the WHO EMRO region, has already drafted a template. And I think that the meeting also they shared with us, we already have it. So they've already gone into all areas of how they're going to look after the elderly population. So I think that would be worthwhile if you look into it.